Dr. Casey,
Oh, hello.
how's it going?
I'm well. How are you?
Doing well. Can you hear me all right?
Yeah, how about me?
Yeah,
Cool.
you sound great. So how's it going?
Awesome. I'm excited to do this with you. What a treat. We usually geek out by ourselves, so I'm glad we can share this with everybody else.
I'm gonna try to turn off the comments. If you have a question, you could put it in the question box. But I'm gonna turn off the comments so that you could see both of our faces.
I mean, I did shower for this, so big things.
Yeah. So yeah, why don't we get started? Why don't you tell everyone a little bit about yourself and your practice first, and why you're the gut expert, and then we'll get started.
Sure. Well, thank you for having me.
Mhm.
For those of you who don't know me, I'm Dr. Bridget Casey. I'm also a naturopathic doctor, similar to Mark. I practice in Rhode Island. I have my own clinic here called Rhode Island Natural Medicine, but I also see patients virtually as well now and do consulting that way too. So my practice is focused primarily on gut health, hence why we're chatting today. But also I do a lot with women's health, hormone imbalance stuff, and autoimmune disease. So I love what I do. I love practicing the root cause naturopathic medicine, but as we know, a lot of it starts with the gut. So it's a big area of interest of mine personally and also as a practitioner. So
Yes, it's all about the gut, and we will be talking about all things gut today. So a little bit about the format. We've got a bunch of questions that you guys have submitted earlier. Thank you for that. And Dr. Casey and I are just going to go back and forth and kind of talk about the different questions and topics you guys have brought up. And if you have any questions, feel free to ask, and we'll try to get them at the end. But let's start off kind of big picture and give us a run through, Dr. Casey, on the GI tract. What's it all about?
sure. So I think it's important I'd like to teach my patients a little bit of anatomy and physiology. So I'm going to do that with you all here today because we think about like my stomach, right? Or my stomach hurts when we talk about gut health. But I think it's important to have a little bit of a better understanding of what your anatomy and physiology actually is and how it's supposed to work. So then you can better understand what may be going wrong for you and or how to communicate that with your providers. So I'm just going to start from the mouth and work my way down and kind of tell you what the digestive tract looks like and what's supposed to be happening. So we know digestion starts, we see our food, and we'll get into this part of it after too, like your nervous system being aware of the food, but you're chewing your food, right? You're mixing it with saliva. That starts the breakdown process, particularly for certain carbohydrates. You're swallowing your food, it's going down your esophagus, gets to your stomach, which is a highly acidic environment. So you should have lots of stomach acid. That helps with killing bacteria and things coming in with your food that you may not want on there. Also helps to start break down your proteins and pull minerals out of your food. So we do really like stomach acid. We need it. Unfortunately, it has kind of a bad rap these days, but we can kind of circle back to that if we want. So you move from the stomach, then the food goes into your small intestine. The upper part of your small intestine is really important because this is where the bile from your liver and gallbladder feeds in, as well as enzymes from your pancreas. So we have kind of what I refer to with my patients as this digestive soup. So that includes your HCl, your stomach acid, your enzymes, and your bile. And these all combine to break down your food. So it's super, super important to have a nice rich, healthy digestive soup to start breaking down your food and pulling nutrients out of your food. And that all functions under parasympathetic, meaning you're in a relaxed state for those things to all come together. So then we moved through the rest of the small intestine, which is primarily about absorption. There's a lot of surface area in the small intestine. We'll kind of dive a little bit more into what else goes on there, but primarily that's where you're absorbing your nutrients. And then the large intestine is primarily where you're dehydrating your stool, so you're soaking out kind of the water. And there's a big portion of your microbiome, which we're going to dive into big time today, in your large intestine, which is those healthy bacteria and microorganisms that we want in there that serve a lot of functions like creating vitamins and different things for us and keeping our immune system in balance. So you go from the small intestine to the large intestine. That's kind of where that digested food becomes stool, and then you're pooping it out, and ideally pooping at least once a day minimum, but 2 to 3 times a day of a well-formed stool is kind of ideal. You can think about like every time you would eat, you'd want to have a bowel movement. And it should be, fairly easy to pass, well-formed, all that good stuff, no blood, no mucus, yada, yada. And I think that's kind of the gist. Did I miss anything?
No, that was a really great overview, big picture look at the gut. Yeah, so let's talk about what are some symptoms of gut imbalance. And maybe I'll field this. So we've got our normal gut flora, which is, somewhere between 10 times the amount of cells in our body are actually our gut flora. So there are commensal gut flora, and then there are bad gut flora, or pathogenic gut flora that can cause symptoms. So when there's an imbalance, we say there's an imbalance with the commensals and the pathogenic bacteria. And some of the symptoms we can experience when we're having an imbalance or a dysbiosis is bloating, abdominal pain, increased frequency of stools, decreased frequency of stools. We can also start developing systemic symptoms as well: brain fog, fatigue, mood disorders, hormone imbalances, immune dysregulations. Really, any large majority of systemic symptoms can be kind of traced back to the gut. So yeah, I mean, it's not a simple question in terms of kind of the symptoms of imbalance, but that's kind of the overall general overview of how you can tell whether or not you're experiencing dysbiosis in your gut.
Yeah, I would just add too, in general, in terms of GI symptoms too, right? Like you may have loss of appetite or reflux, nausea, vomiting, some one of those kind of like upper GI
Mm-hmm.
symptoms, like you mentioned.
Heartburn.
Yeah,
Mm-hmm.
and bloating and all that kind of stuff, and certainly any weird looking stools, blood in the stool, stuff like that. Yeah, constipation, diarrhea are really common too, like you mentioned. So yeah.
Yeah, more towards more the severe gut dysbiosis or gut imbalance symptoms like IBD, intestinal bowel disorder. You're going to have more of the blood and the mucus and the stool and severe pain. But in terms of just a general dysbiosis, yeah, more of those, like you were saying, the reflux or the bloating, more of just kind of the abdominal discomfort, more of the functional kind of GI complaints that we hear a lot about.
Yeah.
Okay, let's jump right into the meat of the potatoes of the talk, is the gut immune connection. And why don't you start us off in terms of what the immune system looks like in the gut and how it kind of affects systemically our immune system.
Sure. So, as I mentioned with the little, physiology overview, our food obviously comes in through our digestive tract. So I think it's important to remember that technically, in terms of like how your body is concerned, your digestive tract is almost like on the outside of your body, right? Because it's how you contact the outside world, right? You've always got this food coming in that wasn't part of your body previously, right? So it's really important to remember that your immune system is on like hypervigilance always around your whole entire digestive tract. So again, that's why we think about like, it's not just about food or digestion. This is impacting your entire immune system. So I mentioned, initially, for example, when your food hits your stomach, you want to have enough stomach acid to start killing bacteria and breaking things down. But also we have in the lining of our GI tract, basically these like sentinel cells, if you will. They're called secretory IgA. You don't need to memorize any of these little details, but we're going to be throwing some stuff at you guys. But these are sort of like the guys that are kind of like standing guard to determine whether or not things are pathogenic, right? Whether or not your immune system should be like, no, this is okay, this is just food, or, oh, this is a bacterial infection, like I need to deal with this. So we have this lining of the gut that's kind of got these guards on track to determine whether or not an immune reaction needs to happen. And in big part, which Mark can speak more to as well if you want, but the microbiome, right, this garden of microorganisms that live in our gut, also have a big impact on our immune system. And they also have a big conversation ongoing with those SIGA immune cells. So hopefully that makes sense. But basically there's like dynamic conversation that's always going on in your gut, regulating what's going on regarding the immune system and inflammation. Is there anything you want to add to
Hello?
this?
Yeah, I lost you there for a second. You're back.
Okay. Where did you lose me?
It was kind of spinning, so I don't know. But
Okay.
yeah, go ahead.
You can. Is there anything you wanted to add to that? I was just talking about SIGA and the microbiome.
Yeah. So the commensal bacteria, there are a lot of studies on how specific species of commensal bacteria or bacteria are part of our natural community, commensal bacteria, provide this kind of, like you were saying, this two-way talk between the immune system. So we have these cells called dendritic cells, which look like kind of like little octopuses. They've got little little tentacles everywhere, and they pull out the tentacles into the lumen, or into the space of the GI tract, and they kind of taste to see what's out there, and they kind of communicate with the good guys, or the good commensal bacteria. And when they talked to them, when they reached out to them and felt them, those good guys actually signaled the dendritic cells to go into the lymphatic system of the intestines, where the majority of your lymphatic system is actually in the intestines. And there, in the lymph nodes, it communicates to T cells and B cells to form different reactions around the body. One of which is start producing T regulatory cells, which are the main anti-inflammatory calm down cells of the immune system. So, and those T regulatory cells then actually go elsewhere in the body. They're not just confined to the GI tract. They actually make it their way to the lungs, to the sinuses, to really everywhere in the body. And they're kind of the anti-inflammatory calm down response. They secrete something called IL-10, which is a major anti-inflammatory cytokine. The dendritic cells also communicating to the T cells, which are upregulating something called the Th1 response, which is the main immune response that our body uses to fight off viruses and bacteria. So we're activating this huge Th1 response to then go systemically to then fight off any bacteria or viruses that may come in contact with other areas of the GI tract, which we don't necessarily sometimes consider areas of the GI tract, like the sinuses and the back of the throat. This is all kind of one large tube all the way down to the large intestine. So it's providing that main Th1, or main antiviral antibacterial response. And also it actually increased something called Th17 cells, which are the cells that actually help tighten up the tight junctions and help produce some of the anti-defense molecules, defensins along the GI tract, help produce mucus, mucus is the main kind of driver of fluid along the intestinal tract. So the more fluid we have, the more we can wash out bugs that kind of land on or pathogenic bugs that land on the GI tract. And then, like you were saying, those dendritic cells also communicate with the B cells, which produce a secretory IgA, which forms kind of like a defensive barrier, defensive layer that's constantly changing based on what's going on in the gut and the makeup of the commensal bacteria. So it's a pretty complicated system, but it's a fascinating system that we love to geek out about and talk about. And there's new information coming out every day about it, and even information on specific species of commensal bacteria, like Bacteroides or Bifidobacterium or Lactobacillus species, which actually help then to trigger those kind of beneficial immune responses that then can go systemic, like we were talking about. So then having strategies around utilizing different probiotics that have those species for different conditions or for systemic immunity is key to kind of our practices and how we utilize or tailor individual treatment plans to patients. So that's kind of the general overview, kind of the bigger overview. And then there are times when that system breaks down, right? And there's an inability for the commensal bacteria to crosstalk with the gut immune system, and we develop pathologies of the immune system, like autoimmunity and autoimmune conditions systemically and also in the gut, through different mechanisms where there's a lack of communication going back and forth between our good guys and our immune system. So it's really a super important part of the immune response that a lot of people don't really you don't hear a lot of talk around the importance of this immune response. You hear people talking about vitamin C and other nutrients that could potentially help the systemic immune system, but really the commensal bacteria and making sure that the commensal bacteria are happy is really one of the #1 ways we can affect the systemic immune system.
Yeah. Yeah, I mean, a lot, we've all heard Hippocrates, like all disease begins in the gut, right? And that's something we've kind of looked at in naturopathic medicine for a long time. So that's why, if someone's coming to see me for an autoimmune disease or hormones or something else, I'm also always looking at the gut, right? It's not just about gut-specific conditions. And when we think about our overall immunity, like Mark was just saying, it's really important to think about, do you have a chronic inflammatory response going on? What's going on in your gut, right? Because it's typically going to be mediated, at least in some part, by your gut health. Or do you have an inability to fight infection? Well, why is that? What's going on with your gut? Let's start there.
Yeah.
And yeah, a big part of that is certainly related to the microbiome too, which we'll dive in about more. What do you want to talk about next?
Yeah. So let's talk about diet. Diet is a big topic. People love talking about it. Let's talk about how the diet affects our gut, kind of in bigger overview terms.
Yeah, also a huge topic. So just as a heads up, everyone, like each of these like sort of things we're going through, we could spend a few hours on probably individually. So nutrition, for example, we could spend many hours on. So we're just kind of hitting the highlights here. If you have questions, obviously leave them for us. But yeah, so diets, I think there's some general themes that make sense for everyone, which would be, eat whole foods as much as possible, eat organic as much as possible, right? Like we know GMOs and certainly glyphosate are really detrimental to the gut health and the microbiome, right? So eating real foods, eating nutrient-dense diet, and eating organic, and certainly having your animal proteins, if you eat them, be wild caught or pasture raised, et cetera. So quality, I think, is a super important piece to talk about for sure. The exact makeup or components of someone's diet, I think, are more individualized, but certainly something that we see, not uncommonly are things like food sensitivities or food intolerances, which would be a little bit different than a food allergy. So if you think of someone like a peanut allergy, right, and they have an anaphylactic reaction to eating that, we're talking more about maybe delayed type sensitivity reactions or things like that. Those can create chronic ongoing inflammation in the gut, right, and kind of lead to some of the issues like Mark was just talking about with dysbiosis and inflammation and leaky gut stuff, which I'll touch on shortly. But yeah, so with diet, I guess I would just say, thinking about are we hitting the highlights, right? Are we getting our macronutrients in, right? Fats, carbohydrates, proteins, colorful fruits and veggies to get our micronutrients in, which are your vitamins and minerals. Are you getting enough fiber to really keep that microbiome happy and pooping regularly? Staying hydrated, of course, we don't want to skip over that, especially if you're constipated. Yeah, so I don't know if there was a specific question about diet, but there's certainly a lot to it. I guess that would be kind of my highlights. I think something else too I'd probably just quickly mention is food timing is also an important consideration to take into account. So that's something you can play around with yourself or certainly try with your practitioners and stuff, whether that be the number of meals you eat in a day or how much, or, if you're doing intermittent fasting or not, or different things, time restricted feeding, different things like that can all help with potentially with gut health and other things. So,
yeah, I would agree with all that. And I would say, it's a really complicated issue that really needs to be taken patient by patient, because you can, make kind of general overview statements, like probiotics are really beneficial and fiber is beneficial for feeding the gut biome. That's definitely true. But then what about patients who are having sensitivities or overgrowths or dysbiosis? Those patients may not necessarily, in the short term at least, benefit from diets higher in fiber. So it's important to really, kind of take everything into account. And we certainly love talking about diet, love discussing diet with patients, and we definitely go carnivore, there's paleo, can you hear me? Sorry.
yeah,
There's carnivore, paleo, vegan, specific carbohydrate diet, low FODMAPs, high FODMAPs, low candida diet, SCD diet. There's so many different options, and they're all on the table basically for everybody. And in Chinese medicine, from Chinese medicine perspective, they say that ideally, there's different animals that are associated with different organ systems in the body, and the small intestine in Chinese medicine is associated with the goat. And when you think about a goat, goats can eat anything, right? They can eat cans, they can eat trash, they can eat metal, and that's kind of how we want to be able to, in a healthy world, in our most ideal state, that's the way we should be eating. We should be able to eat anything we want without having issues around digestion, around our gut. So that's the goal always that we're trying to bring patients to, the ability to eat anything happily and successfully. But along the way, along that journey, there are different things and different diets that we need to potentially address before we kind of get to that end stage. But yeah.
Totes.
So that's a great lead into our next topic, which is, what is leaky gut, Dr. Casey?
Ooh, super hot topic always in sort of the functional medicine, naturopathic community. And a lot of folks I find have either come in seeing me asking about it because they've read about it online and what have you. So just a brief overview of what that actually means. So like I mentioned, your small intestine is primarily where you're going to be absorbing your nutrients, right? So it's a semi-permeable membrane, meaning that, you want to let nutrients in. You don't want it to be completely, you don't want things to have no ability to pass through, right? The lining, but you also don't want it to be completely porous either, where it's just like everything and anything can kind of pass through. So your body should typically, like I said, it should be semi-permeable, and your body is usually monitoring what things it's letting through, which would be like broken down and prior digested food. You don't want like full protein particles getting through, or, bacteria and different things. And so, Alessio Fasano is the Italian researcher who's done a ton of work on this, and I would say is kind of the main expert in this area. If you're someone who's interested in reading research, check out his name. But basically, he's discovered that zonulin is a protein in your body that basically monitors those tight junctions, and so the cells of that line your small intestine should be like fitting together, right? But see how there's like a little bit of a hole there, like maybe a little bit of some nice broken down food is going to get through and get absorbed. If you have a lot of zonulin in your system, which can happen because of, right, dysbiosis, gluten is actually a big trigger for this, certain foods. So food intolerances, I would say, and dysbiosis and kind of any inflammation in the gut would be like the main reasons this happens. Zonulin levels go up, and then your tight junctions, which are normally looking like this, end up like this. And then you have all sorts of stuff getting through that you don't want. Like I mentioned, undigested food, bacterial particles, and other antigens, basically things that are going to set off an immune reaction and increase your inflammation, and can lead to other things like it can trigger autoimmunity, which is a whole other topic we won't bother getting into in detail right now. But essentially, you don't want a leaky gut. It's no bueno. But, the main reason we want to get back to, like, why did it happen and how do we prevent that? And then, kind of seal up the gut. Did I miss anything?
Yeah, well, maybe like a quick overview of some of like the big triggers for that. What are people consuming or doing in their day-to-day life for the majority of people that could potentially increase that leaky gut for them?
Yeah, so the big one that I mentioned would be like food intolerances, and there's actually a lot of studies around gluten specifically on this that do it. So it's not that I like hate gluten for everyone, but there's just a lot of research that says even in healthy individuals that it creates transient leaky gut. So it's a big one to consider. That being said, gluten-free foods are not always healthy, so we'll have a little conversation on that. But that's a big one. But I would say beyond that, I would actually I would increase that to say any food sensitivity or intolerance can do this. Dysbiosis, overgrowth in the gut's a really big one. So I think you already touched on this, Mark, but SIBO, or small intestine bacterial overgrowth. So in the small intestine, you don't typically have much bacteria. It's mostly normally in the colon or the large intestine, right? So if it backs up and you get excess of that in the small intestine, which creates a lot of IBS type symptoms usually, that can be a big trigger for leaky gut. So I would say probably food intolerances, SIBO, and eating foods that aggravate your gut, in any sense, meaning like maybe foods with chemicals on them, like I mentioned, glyphosate, I'm saying it wrong, earlier, which is what's in Roundup and in a lot of your conventionally grown foods. So things like that are kind of the main triggers that I see.
I would add NSAIDs.
NSAIDs
are a big trigger that more and more research is coming out on NSAIDs, and aspirin and ibuprofen, things like that, actually breaking down the gut barrier. I would add alcohol as well. Although majority of alcohol is absorbed in the stomach, some does make its way into the small intestine and can break down leaky gut. Sugar as well. I've been seeing more and more studies how sugar in general, processed foods, can actually stimulate the breakdown of the intestinal barrier and increase leaky gut. So yeah, I mean, it's a big topic of research. you know, back in the day, people were called crazy for even talking about leaky gut, but now then
Yeah.
in the literature and the scientific research, it's all over the place, and now people are talking about leaky gut syndrome, kind of like
Yeah.
IBS used to be, you know, irritable bowel syndrome. So it's coming into its own light as a you know recognized condition. But yeah, it's a major cause of a lot of systemic issues.
Something I would mention or throw in here too is that the nervous system often doesn't get addressed, I find, with gut issues, and it's a really important part of it. So I touched on this briefly earlier, but your digestive tract functions under parasympathetic control. So your autonomic nervous system has two sides: sympathetic, which is that fight or flight mode, right? Like I'm stressed out kind of mode, which is where a lot of us live all the time. But then there's the other side of that, which is the calm resting. It's called rest and digest mode, which is parasympathetic. You basically need to be in parasympathetic mode for your digestive tract to be getting the right signals and doing things correctly. So not that it's the number one cause of leaky gut, but it definitely worsens things if you're under constant stress. And if you're ever trying to heal your gut, it's really important to address the nervous system as part of that whole process. Yeah, so I just wanted to
Yeah,
mention that too.
super important, and something that you know even practitioners forget a lot. You know,
Mm-hmm.
that we kind of get absorbed in kind of fighting off a particular bug, and we don't really take a step back and say, wait a second, you know, is this person sympathetic or parasympathetic dominant? You know, what can we do to calm them down, put them more in that rest and digest state,
Yeah.
in which they're, you know, they're going to be producing more enzymes, digestive enzymes. They're going to be breaking down their food. That food's not going to be feeding the gut dysbiosis. So it's a super important piece. And mental, emotional strategies, meditation, hypnosis, self-hypnosis, EFT, yoga, anything you can do to calm your systemic nervous system. And eating in a state where you're calm is going to be super important.
Yes, big time.
Yeah,
Even if that means just taking like 5 deep breaths before you eat or saying a quick prayer or something,
yeah.
it can be huge for your
It's
gut.
really, yeah, super
Hmm.
important. So along those lines, I wanted to touch on something called LPS,
Yeah.
which is getting a lot of interest in research circles. LPS stands for lipopolysaccharide, and it's the protein that surrounds certain gram-negative bacteria in the gut, certain beneficial and parasitic. Sorry, I got parasympathetic in my mind. Parasitic and commensal bacteria, and it's this protein coating that in the presence of leaky gut can actually leak into the system and go
Hmm.
into systemic circulation.
This
And
is
it's
huge.
and in systemic circulation, it causes a lot of inflammation. It's been linked with cardiovascular disease. It's been linked with systemic inflammatory conditions, autoimmune conditions, allergies. Basically, all chronic disease has been linked to LPS, and more studies are showing that LPS is plays such an important role in chronic degenerative diseases. So LPS gets in the system, and one of the main kind of ways our body fights this or creates an anti-inflammatory response to calm down the inflammation that's being generated by LPS is upregulating something called ACE2. ACE2 is an enzyme that's also a receptor on membranes. It's responsible for lowering blood pressure, for lowering inflammation, and ACE2 receptors are found all over the gut, all over the lungs. The lungs have a lot of ACE2 receptors, the kidneys, the cardiovascular system. It forms lining of the large blood vessels. It's found in the brain. I mean, it's in a lot of locations in the body. The problem we're having right now is that COVID, SARS-CoV-2, the virus that causes COVID disease, binds to ACE2 receptors to get into cells. So viruses, they cause all of their problems by invading cells. They can't actually replicate on their own. They need to go inside of a human cell, take over the machinery, the mechanics of cellular replication, hijack it, and then give their RNA or DNA to the host cell, and then say, start making more of these, and we're gonna start replicating. And then it bursts open, and then just keeps doing that over and over again. That's the life cycle of a virus. So in order to get into the cell, it needs to bind to ACE2 receptors. This specific virus, SARS-CoV-2, binds to ACE2 receptors. So we've got all this inflammation, we've got all these, you know, juicy ACE2 receptors, and now this virus comes along and says, whoa, this is amazing. Look how many ACE2 receptors we've got. Let's just start bombing these cells. Let's go inside. And what we're seeing is people who have systemic inflammation, people who have comorbid conditions like diabetes, metabolic syndrome, things like that, that are characterized by increased inflammation and increased ACE2 receptors are having a way harder time with this disease than anybody else. I mean, upwards of 80% or more people who are dying from COVID are people who have at least one of these comorbid conditions. So LPS increases those ACE2. So getting a handle on, reeling it back and getting a handle on the gut, making sure that leaky gut gets contained so that LPS isn't thrown into systemic circulation is really going to lower the inflammatory burden for the body in general, and then decrease the severity of the COVID disease. So it's really poignant and really you know, of the moment that we're talking about LPS and the gut, because of its connection to systemic inflammation. And a lot of these studies are really new, you know, that have come out that I've seen around the lung inflammation and LPS, increased ACE receptors specifically in the lungs, where a lot of the damage is happening in COVID patients, and then LPS increasing those ACE2 receptors in the lungs. So yeah, it all comes back, well, at least this part of it comes back to the gut, and treating the gut is super important, and tightening up those tight junctions should be part of our, you know, any, you know, legitimate kind of plan to support the immune system.
Mm-hmm. Nice microbiology overview there.
That was a, you know,
who's still with us?
Yeah.
I feel like I was back in microbiome class. No, that was good. Just to kind of review the highlights for you guys. So LPS, I think about it as like a little stick that comes off you can think of like a bacteria as like a ball, and LPS are these little sticks that stick off of gram-negative bacteria balls, okay? And what's happening is they're getting through that leaky gut, which they would not normally, right? So if they get through the gut, they get absorbed into circulation. Those little sticks come off the ball, and it basically tells your immune system, like, time to go haywire. Inflammation is going, pew. So that's just like generally what's happening, in case anyone lost you. But that was awesome.
Right.
Good job.
Right. And then as a response to that inflammation, we're upregulating those ACE2 receptors.
Yes.
Yeah.
Yes. Yep.
Yeah, we got there. I like your, you know, your larger
I like to
picture.
keep it big picture.
Yeah, I like it. No, it's important. I gotta get zoned
the
in.
Dynamic duo here.
Yeah, I get zoned in on the details and I get lost, and I'm like, did I lose people? But I'm like so into it. It's fascinating to me.
It is.
Anyways, let's move on.
Okay.
Let's talk about probiotics, and it's a big topic. Again, another big topic.
Yeah. Also could spend all night.
Yeah. So let's talk about probiotics and their effects on the immune system.
Okay. Okay, so let's back up. So we talked about the microbiome, right? So this term refers to, I like to use the analogy of a garden. So I mentioned most of this beneficial microorganisms called the microbiome lives in your colon, right, in your large intestine. We also have this like on our skin. We're basically we're bags of bacteria and and viruses and microorganisms of other kinds. But the thing is, we need to keep that garden happy, diverse, healthy if we want ourselves to be happy and healthy. Okay. So with this garden, right, you want to think about, you want happy you want healthy, soil. You want a diverse mix of things that you're growing in your garden, right? Whatever it is that you want there, whatever you've planted, and you don't want a bunch of weeds taking over. Okay. So when we think about probiotics, I use this analogy because I tend to use 3 different categories of probiotics. And again, like Mark mentioned earlier, what I'm recommending for someone depends on their situation. So I don't really have like everyone should take this. It's more like depending on what I'm recommending for someone depends on their situation. So I don't really have like everyone should take this. It's more like depending on the individual, but there's 3 different categories that I look at. And so one would be the probiotics that most people are familiar with. Probiotic just means it's like a beneficial bacteria or something that's going to help the flora in your gut, help this garden, right? So Probiotics that you're probably familiar, like lactobacillus species and bifidobacterium species. Those are the two most common species, and then there's specific strains within both of those categories. But if you see any sort of general mixed probiotic, that's typically what's going to be in there. I think about those again, they're generally healthy for most people, but different strains and different amounts are going to depend on the person, right? Those are kind of like planting seeds in your garden. That's the stuff that you want to grow. Those are the happy bacteria that do good things for you that you want in your garden. The other two categories are less well known, are soil-based organisms, which I do use a lot. This is basically, like the name implies, it kind of keeps that soil of your garden happy, right? It keeps the pH balance. It keeps the stuff growing that you want to grow, right? It's feeding your healthy things that you're growing. How many times did I just say growing? But yeah, so soil-based organisms, it's normally like what would literally be on the little bit of dirt that you're eating on your vegetable. But unfortunately, because of our food supply chain and soil quality issues and so forth, we actually don't get exposed to these nice soil-based organisms as much as we were previously. So I do think that's something that's kind of generally deficient for people. So that's the second category. And then the third category would be beneficial yeast. The main one that we know of is Saccharomyces boulardii. This is something I, again, also will use pretty regularly, again, depending on the person. But this is kind of like a gardener, I guess. It goes in and it sort of like takes out the weeds. So it's getting rid of, crowding out stuff that you don't want in there, and kind of keeping it, a happy environment for the rest of the organisms that you do want there. So those are sort of the three different main categories of probiotics. Again, the strains that you're going to use, particularly when it comes to that first category, really, in my opinion, depend on the person in terms of what would be best. Yeah. Anything you want to add to that?
I would maybe add another category around spore-based probiotics.
Oh, sorry, that's soil-based and spore-based is the same in my.
Oh, is it? Okay.
In my world, I don't know.
I like it.
Yeah.
Yeah, there's a lot of research around spore-based. They're encapsulated probiotics that they can make it further down in the digestive tract. So a lot of people who are critical of probiotics say, well, the majority are getting that being broken down by your HCl in your stomach, and it's not really beneficial. So, what's the point? Whereas spore-based probiotics actually can withstand degradation by those enzymes and by the HCl in the stomach, and can make it further down, but then they can seed the soil of the gut. Yeah. Great. Yeah. That's some good stuff. And then prebiotics, the difference between prebiotics and probiotics. Prebiotics are the carbohydrates in our food that actually feed those gut bacteria, those beneficial gut bacteria. So they're kind of another aspect of the strategy, the probiotics and then the prebiotics.
Yeah, and you may even see in some of your probiotic supplements, you'll see things like inulin or FOS. They'll actually have prebiotics in a lot of probiotic supplements to try to keep the probiotics species alive in the supplement. And, some people do better or not on those, depending if they have, overgrowth or other issues. Sometimes those can be aggravating, but you'll see that as like a component of some probiotic supplements as well.
Yeah. Awesome. Moving along to this. So stress, anxiety, symptomatic dominance, and the gut response. You touched on this a little bit already. Do you want to say anything more on
Yeah,
on
I think we kind of covered that. I mean, I think it's just, again, important to remember that, digestion only happens in parasympathetic mode. And so really thinking about what you can do to help yourself get in that mode as regularly as you can, but especially around meal times. So if you're eating while you're running out the door, while you're driving to work, while you're yelling at the kids, like, it ain't gonna go well. So if you're having, gas, bloating, whatever, abdominal pain, but you realize like you tend to eat in that state a lot, very first thing I would say is, why don't we start trying to get, in a calm state before you eat and see how you do then. So sometimes it's just a matter of like retraining your habits and your nervous system a little bit around mealtime.
Yeah. Awesome. How can we best support our gut and heal leaky gut?
Oh, big topic. Okay, so yeah, so well, you know, for one thing, like I just mentioned, would be to get in parasympathetic mode when you eat, for sure. You know, there's a lot of different strategies you can take. I think for kind of going back to all the stuff we've mentioned already, like nutrition, right? What are you eating or not eating? So things you can add into your diet that may be helpful. Maybe probiotic-rich foods will be helpful for you. Maybe fiber-rich foods will be helpful for you. You know, maybe it's about avoiding a food that's like feeding the flames of inflammation in your gut for you. So if you have a food intolerance, or, you know, every time you know, eat dairy products, you get bloated and have diarrhea, that's a great sign that your body's having an inflammatory response to dairy, or whatever it is for you. So, you know, trial and error potentially with diet, but you can also sometimes, there's a lot of different ways to test for food intolerances too. Some are certainly better than others. So I'd say avoiding foods that bother you, eat foods that help you, that feel good. Work with someone to help you figure that out if it's too confusing. You can certainly do, you know, we obviously have a lot of tools in our toolkit. So that could be, you know, herbs, bitter herbs, you know, herbs that help with lowering overgrowth of bacteria. It could be things to soothe the gut lining, right? There's a lot of great herbs and supplements that do that, particularly when we talk about leaky gut. So we could talk about that. What else? Enzymes, HCl, you know, you can help kind of support and supplement the normal, the stuff that would be in your digestive soup normally. You can take all of those things as supplements, you know, to help with yourself breaking food down and while you're healing things up. I wouldn't necessarily want to be doing that long term. You kind of want your body to do what it's supposed to do, but that can all be helpful in the right time and place. Yeah, I mean, there's a million things, homeopathics, drainage. Do you want to talk about that?
Yeah, well, I just a quick question follow up on that.
Oh,
Do
sure.
you, when you're putting, I don't put a lot of patients on enzymes.
Mm-hmm.
I tend to do more of the bitters and
Yeah, same.
kind of just let them. But I was wondering, yeah, what your experience was around enzymes, and if you did see that there was a decrease in their ability to produce them naturally. Like if they go off it, do then all of a sudden start bloating up again, for
Right,
example?
right. Yeah. So, so what Mark mentioned, we both use bitter herbs more than enzymes because bitter herbs literally, as the name implies, are bitter. And so when you eat them, you digest them, they stimulate your body to produce stomach acid and get those enzymes going and get the bile out of your liver and gallbladder. So they're stimulating your natural production of the digestive soup. And that's why we both prefer it, because it's getting your body to do what it should normally be doing, right? So I personally do have a preference for that. But I will use enzymes occasionally. And, you know, it depends on the person and, again, and what's going on. So usually I use them more short term while we're maybe healing up what's going on in the lower GI tract. So that food's getting down there in a broken down state, and we can kind of reduce some inflammation and heal up leaky gut in the meantime. So I don't keep people on them long enough to, you know, really suppress their own supply of digestive enzymes, at least not that I've seen yet. So that's good. But yeah, sometimes there can be transition periods, I think, with any therapy or anything. Yeah.
Yeah. Yeah, I totally agree with all of that. I would say, you know, being in a parasympathetic state is so important. Making sure that people's digestive enzymes are optimized and that they're digesting their food. And then if there is a dysbiosis present, if there's an overgrowth or there's a parasite or there's candida or there's a fungus or whatever else going on, definitely treating that. And I like to think of like in the similar analogy of like the garden that's overgrown, right? There can be just too many weeds and you haven't tended to the garden and there's kind of, you know, chaos that kind of ensues. So trimming down that garden with antimicrobial herbs. I mean, I have used antibiotics in the past for certain conditions. You know, we're going to be talking about different functional testing that we do, but I like something called a GI map, which is a DNA PCR test of the stool, which looks at very specifically what are the specific strains of different fungus, bacteria, even viruses, pathogens, worms in the gut, and depending on what shakes out and depending on the patient's symptoms, because sometimes you can have a really positive, you know, map and they're not really symptomatic, and you're like, oh well, I'm not necessarily going to start bombing them with antimicrobials. But depending on what shakes out, you know, giving antimicrobial herbs or herbs that target and kill off that overgrowth or kill off those parasites, you know, allicin from garlic, oregano, berberine, grapefruit seed extract. All these are really powerful antimicrobials that kill off overgrowth. So working on that overgrowth is definitely important. And once that overgrowth has been healed up or dealt with, then we can think about healing up the gut. And I like to think about using collagen. Collagen has different peptides that are really important and provide the amino acids for these cells of the intestines to kind of heal up and kind of start tightening up again like a zipper, kind of healing up that zipper again. So colostrum is really beneficial at doing that. Certain probiotic species like spore-based probiotics can help heal up the gut. So there's different methods and things we could potentially try to heal up the gut. And once it's healed up, then kind of reassess to see what else needs to be done. And using the patient's symptoms as a main driver of treatment, because I know a lot of times practitioners get really excited about these tests and they're like, oh, we got to treat the test. And I say I'm not treating the test, I'm treating the patient. And using their symptoms. How are they feeling? Are they still gas and bloated? How are the stools? How are their systemic symptoms? How's their energy? How's their fatigue? How's their their joint pain? How are all these things improving and changing as we kind of treat the gut and kind of work on healing the leaky gut? So that's kind of the way I think about it. Yeah, and I definitely like to use drainage as well in homeopathy, different techniques at stimulating the body's natural self-regulation, so that you're not. The idea with a lot of those homeopathic remedies is that you're helping to stimulate the patient's vital force so that their own self-regulation can take over, that you're not constantly managing symptoms for them. Then it becomes an issue of managing their symptoms their whole life, whereas you want them to kind of get a handle on their symptoms and start regulating their gut health and immune health on their own without constant input from a practitioner. So that's kind of the way I think about that.
Yeah, right
on. So speaking of tests, let's talk about some tests that you like to use or some in your practice to kind of get a handle on what's going on in the gut.
Yeah, well, pretty similar to you. I mean, I do a pretty extensive patient interview. So my first patient visit is 2 hours long. And that's because I spend a good chunk of that time getting to know my patient. So it's not just about one thing. It's looking at their whole lifestyle, other symptoms, their whole kind of person. So it's definitely an extensive patient interview, finding out what their symptoms are, what they're dealing with, what their lifestyle is. And then I'll use functional testing occasionally. So, again, like you said, I want to know what's going on for them. So it depends on the person. Also, frankly, this stuff isn't free. So, if it was, I'd probably do a lot more of it with people, but it's not cheap. So I try to really focus on like how they're feeling. And if I feel like we can move ahead without testing, we will. If I feel like I really need to know, like if someone's, especially for inflammatory bowel disease, if someone's having severe bleeding or diarrhea issues that are not clearing up, or they're coming to me with severe issues, I may pretty quickly recommend doing something like a GI map, because I want to make sure if there is an infection, we're treating that, because it can be hard to, manage flares or things if there's an underlying infection that's going on. So, in cases like that, I may pretty quickly recommend a GI map, but otherwise it's typically like, let's start treatment and see how we do. And, I also use applied kinesiology in my practice, which is a form of muscle testing where I can kind of get a sense for, again, what's going on under the hood and a little more information directly from a patient's body about what's going on, and use that as a way to also gear which therapies are resonating with their system better than others. So yeah, I would say that's kind of it's a combination of physical exam, muscle testing, patient interview, and then occasionally functional testing as needed.
Yeah. Same. Yeah, I really like using those functional tests. I try to recommend it with most patients, I'll be honest. They are expensive, but I like to get a really good look at what's going on with the GI map and tests like that. I also like using organic acids tests, and there's a newer test now called the microbial organic acids test, and those are urine-based tests, so they're easier sometimes for patients, because the stool tests can be difficult for patients to do sometimes, just because the ick factor, they don't like to collect their own poop. So urine tests are better. I also do energetic resonance testing as well, similar to applied kinesiology. where it's helping to guide my understanding of priority of treatment for patients, to kind of figure out, all right, where do we need to go with all the options that we have? Where are we going to get the most bang for our buck, and if we kind of pursue that path for this patient? So I like doing a combination of those things. And again, also, yeah, the patient interview and getting a good sense of their symptoms and how they're experiencing their symptoms is really important for me as well.
For sure. Everyone's unique. So I think that's an important thing to remember, because we obviously, and we'll dive into some of the questions we got to, or other questions we got, but, people always want to know, what do you give someone who has IBS, or what do you give someone who has, Crohn's disease? It depends on the person. That's the nice thing. It's tricky because you may not get a straight answer, I guess, but naturopathic doctors focus on the individual. So every treatment plan is a little bit different because we want to treat you. You are not your diagnosis. You have symptoms and things that you're dealing with, but you are an individual. And I think it's important to, whenever possible, individualize treatment. So it's an important piece to remember when you're looking for solutions.
Yeah, 100%. And we have those tools like with applied physiology and resonance testing, which are really super specific and individualized for the patient.
Yeah.
Awesome. Well, we're kind of almost running out of time, but let's get to a couple of questions. What if you have gut sensitivity to fruits and vegetables? So yeah, so some people, we kind of touched on this a little bit, but some people are sensitive to certain fruits and vegetables, and I'm assuming this is maybe a little bit more for immune health, like if you can't get the nutrients you need in specific foods, for example, like citrus with vitamin C, or seafood for zinc, or things like that. So what do you say around something like that?
Again, it really depends. So I don't know, if that's someone who can't eat any fruits or vegetables, right? Like you may want to be focusing on supplementation, or even finding a practitioner who does IV therapy or something in the meantime while you figure it out. But I wouldn't, if you can't tolerate any fruits or vegetables, that's a huge sign that you got to do some gut work so that you can get your absorption and digestion improved. But certainly there are folks who have sensitivities to, phytochemicals, which are chemicals in food that primarily act as like plant defense mechanisms. So that could be things like lectins or what have you. So, sometimes there's categories of foods that people really don't do well with, and it can be based on different food chemicals. This is a kind of a complicated topic, so I'm not going to dive too much into it, but if you can figure out what food specifically you find you react to, maybe that's through trial and error or an elimination diet and retrial, that can be really helpful to like kind of map that out and bring the information to your practitioner, and they can help you sort out what's the common thread, or potentially you could figure that out yourself. Again, you could try to look at food intolerance testing, other things like that. But usually there are foods in each category. We talk about like immune support. So we're thinking about like vitamin C rich foods, zinc rich foods, carotenoids and vitamin A rich foods. There's usually going to be something in that category that you can tolerate, if that makes sense. So, even if you can't do, I don't know, berries, right? Like there's still other foods that have carotenoids and that still have, vitamin C and stuff in them. So I would look at, you can even check, I just did an immune support challenge. And so if you want to check out my clinic account, Rhode Island Natural Medicine, there's a couple of stories, and I list out all the different things you can do for immune support, a lot of which is nutrition related. So, but you could super easily just Google, what are vitamin C rich foods, and go through the list and realize like, okay, maybe I can't handle, this particular food, but I can do this one. So that's kind of be my short answer on that, I guess.
Yeah, I would agree with that. I would say, yeah, definitely if you're having issues around fruits and vegetables, then likely there's a dysbiosis going on in the gut, and that needs to be addressed first before anything else, really. I mean,
yeah. And in the meantime, supplement and find other ways to get those nutrients in, because obviously they are important. But you may have to find other ways to get those in the meantime.
Yeah. I want to see real quick. Someone asked some questions. See. That actually wasn't a question. They're just saying this is great. So what are some immune building foods for someone with irritable bowel? What would you say for that?
That would kind of go back to the what I was just saying, that it kind of depends on the person. So, irritable bowel can be for a variety of reasons, and it could be like certain food intolerances that are bothering you, or it could be dysbiosis or, whatever. So, I would deal with the irritable bowel primarily, but also again, go through the different foods. So like, um, say you can't handle, like I said, like berries or kiwi or something, but you could still eat greens and broccoli and bell peppers, for your vitamin C, or you could do, for your carotenoids, that's all the colorful, like carrots, squash, pumpkins, tomatoes, stuff like that. Maybe you don't do well with like the nightshades, right? Like tomato and peppers and, eggplant and stuff like that, but you do fine with cooked carrots. That's, for example, something that's super easy to digest. And usually, like I would say, cooked foods in general, people tend to do a little bit better with, as opposed to raw foods, especially digestively speaking. So, maybe you can't handle raw spinach, but you can handle, cooked spinach or cooked, chard or kale or something like that. So, I would say just try to like look at a variety of things. Zinc-rich foods, I know you did a great post on that, are super important. Quercetin-rich foods, super important. So yeah, I would say it kind of depends on the person, but you could also try other things like teas are a great way to get in some of these nutrients and potentially help the gut, depending what kind of tea you're doing. So, like ginger can be really helpful for the gut. Turmeric can be really helpful for the gut. Those are more generally heating herbs, but you could think about that, or you could try like peppermint tea or spearmint tea, or more cooling. All of those are really useful teas and also nutrients that can help with IBS. But again, you can think about probiotic rich foods and see how you do with fermented foods. You could see how you do with fiber rich foods or not. So it all kind of plays together. I would say it just depends on what you're specifically, how a specific person reacts, I guess. I don't know if that.
Yeah, no, that was great.
Helps, but
That was super helpful, and a great overview of some of the key nutrients for the immune system.
mm-hmm.
So we're almost out of time, but one more question here on, can we speak about postnasal drip? So when I think of postnasal drip, I think of primarily first histamine reaction and allergies, but I do have a patient now who does have dysbiosis of the gut, candida overgrowth, and candida overgrowth in the intestines, but then also potentially you could think about fungal overgrowths in the sinuses as well, which can lead to postnasal drip. So, like we said earlier, it's one giant connected piece from the mouth down to the anus, and we don't tend to think of the sinus tract as part of the gut, but there's a mucous membrane there, and there's there's a membrane, a permeable membrane that we need to make sure is tightened, and that isn't leaky, and that it communicates properly with the immune system. So treating any infections in the sinuses is gonna affect the gut, and then treating the gut is gonna help the sinuses as well. So that's kind of where I think about that.
Makes sense.
So yeah, this was really great, Dr. Casey. Thank you so much.
Thanks for having me.
We should do this more often. This was really fun.
Would love to.
We can maybe dive into more particular specific topics and have more time on.
Yeah, for sure. Yeah.
Yeah.
You guys should let us know what things we touched on that are interesting to you, that you want us to dive into more. We love all this stuff, so we can geek out anytime you want.
And go visit Dr. Casey's Instagram and Rhode Island Natural Medicine, her clinic account.
Thanks.
All right, Dr. Casey, I'll talk to you later. Bye.